So we already have the physician orders for our patient, and we already know her diagnosis is influenza A and dehydration. So now it's time for you as a nurse to make your assessment and to consider what nursing interventions might be appropriate. So she's tachycardic right now. She's presented to your floor, and she's in your room, and she has a heart rate of 110. So we're going to monitor her heart rate very, very closely. It's probably high because she's dehydrated. She also has some dry mucous membranes, again, dehydration. So we want to encourage her to drink fluids. If she's not drinking them, we just kind of just help her with that and maybe think of some things she would enjoy drinking. We're also going to go ahead and start what the physician ordered for the continuous IV fluids. She also has a non-productive cough. Now her chest x-ray was negative, but she has a history of COPD, so we really want to watch it and encourage her to do some deep breathing, encourage her to cough, and we may even consider doing an incentive spirometer with her to help prevent her getting a complication such as pneumonia. She also is intermittently confused, so she doesn't remember why she's here or where she's at sometimes, and so we want to monitor her for falls. We're going to put a bed alarm on her. We might move her closer to the nurse's station, and she might even need a sitter if it gets bad enough. She's very lethargic, and she's sleepy a lot. Her respirations have slowed down to about 14. We really want to watch that. We're going to put a continuous pulse ox on her and monitor her oxygen saturation continuously just to be on the safe side. Some questions for stage 1. How might her home medications put her at risk for infection? And second, what consults would be appropriate for you as a nurse to make for patient X? So her home medications, let's take a look at those. She takes Lasix. This helps with her CHF and her hypertension, but Lasix is also a diuretic, so it can complicate things when it comes to hydration. It can make her dehydration worse, and so it's a fine balance that are going to play with that. You know, how many fluids do we give her so that we don't complicate her CHF, and how much Lasix does she need? So we really have to keep a fine balance on that and work with the doctor and pay attention to her symptoms and her reaction. She also takes Restoril, which is contraindicated for patients over the age of 65. It can actually cause more lethargy during the day, and since she's already feeling lethargic, we really want to pay attention to that. We might look at a better option for her for a sleep aid. Another is her inhaled corticosteroid. She has COPD, and typically the steroid, you think of steroids, they're going to inhibit the immune system. Well, they found that corticosteroids inhaled don't typically do that. However, if she was to be found to have any pulmonary effusions or infiltrates, we would want to stop her inhaled steroids because then it can cause complications inside the lungs. So we're going to take a look at those. As far as the second question for what consults might be appropriate, well, a pharmacy consult, right? Yeah, so she's suffering from polypharmacy, and she might need some help, finding out what's the minimal amount of medications we can give her to help her with her problem. It's a fine balance, and a pharmacist could sit down with her physicians and hopefully come up with some better options for her. She's probably experiencing some depression, given her social history and her prescription for Effexor. So maybe a consult from the chaplain might be good. She's, definitely this is going to be a step back for her. It's scary when people are admitted to the hospital and she's so sick. So this can add to her depression issue. So chaplain visit is a good consult as well. She's also feeling confused and lethargic, so she's not moving a whole lot. I think a physical therapy consult might be appropriate as well. They're going to get her up and ambulating. This can improve her condition and her mood. Movement is great for not only elderly people, but for all of us. But elderly, and most importantly, they become weaker much more quickly than we do. They can lose the ability to walk in just a few days in the hospital, so we want to get them up and moving. So that would be pharmacy consult, a chaplain consult, and a physical therapy consult.